Dog owners should be on high alert as cases of canine flu crop up across the country. Canine flu is highly contagious, and if left untreated, can lead to dire complications, including pneumonia. Here to explain the causes, symptoms, and how to keep your dog safe from canine flu is Dr. Andrea Sanchez, a veterinarian at Banfield Pet Hospital. Doctor, what should we know about canine flu?
There are a lot of things I want people to know about canine flu, but I'll start with the basics. So canine influenza virus, or dog flu, is similar in dogs as human influenza virus is in people, in that it's contagious from dog to dog the same way that human flu is from person to person. But when we're talking about canine influenza virus or dog flu, we're specifically referring to two strains of influenza A viruses that only infect dogs, or at least primarily infect dogs, sometimes cats. These are not strains that are infectious to people. But the reason we're worried about them is that in the last 2 years in particular, there is a new strain of canine influenza virus that's been sort of popping up all over the country in these various localized outbreaks, and we think it's more contagious than the previous strain of canine influenza. So as veterinarians, we're on high alert, and we want dog owners to be on high alert as well.
Are there symptoms we should be on the outlook for?
Yeah, absolutely. And the most important question to ask is, where has my dog been lately? Has my dog been somewhere where he was around, or he or she was around a lot of other dogs? So was my dog at a boarding facility, a dog park, a grooming salon, anything like that? Because those are places where we see canine influenza be likely to be contagious. And so that's the first question to ask. And then the next is my dog coughing? So the first thing you're going to see in canine influenza is a dry, hacking cough, almost like the dog's throat has something stuck in it and they're just really trying to get it out. This can sound a lot like kennel cough, so it can be a little tricky if you're familiar with the more commonly known kennel cough. At first, influenza sounds and looks a lot like that. Canine influenza can also be accompanied by a runny nose, and then a more advanced form of the illness may be your dog showing signs of a fever. So David here is fine right now. He's just relaxing. He's not sick at all. But if your dog were sick, your dog would be sort of losing that energy level and that usual pep that they have, maybe not wagging their tail as much as they used to, and may suddenly stop eating. Any of those more advanced signs are definitely more of a concern that the illness has progressed and gotten serious.
What should we do if we suspect our dog may have canine flu?
Right. Well, the first thing to do is to call the vet's office, because your vet's probably going to ask you. I mean, I'm a veterinarian and I work at Banfield. When I'm in the hospital, if someone calls and says, I think my dog is exposed to canine influenza, or my dog's coughing, what should I do? I'm going to find out a little bit more about what's going on with the dog. And if you're going to tell me that the dog is coughing but otherwise eating and wagging his or her tail and running around all playful, my recommendation is actually going to be stay home with your dog, or keep your dog at home for a 3-week period. And that's because canine influenza can be infectious and contagious for 3 weeks. During that 3-week period, of course, we're monitoring very closely every day to see if your dog develops any of the more concerning or advanced signs of canine influenza virus. Because if any of those more serious signs that I talked about, like not eating or sluggishness and losing their energy level, if any of those occur, we're actually going to recommend that you bring the dog right in to the vet for supportive treatment.
If our dog should have canine flu, what treatments are available?
Well, it is a viral disease, so treatment is largely supportive. And I will say, before I describe much about treatment, I will say vaccination is always, when possible, the better option to prevent the disease rather than have to treat it once the dog is already sick. So there is a vaccine available for canine influenza virus, and it does get both the new and the old strain. If your dog does get sick, though, and get some of those more advanced signs of canine influenza, your dog's doctor is going to do similar to what your doctor would do for you if you came down with a bad case of the flu. We would probably end up putting them on an IV, giving them IV fluids so that they can get rehydrated, get their electrolytes balanced. Your vet might even add some pain medications and antibiotics, depending how bad the coughing is, and or if there's a bacterial infection. Some vets will add anti-cough medications too. So yeah, treatment is really until the dog is feeling better. But in all cases, we generally recommend you have a discussion with your veterinarian about whether vaccination is a better option for your pet, depending on your pet's lifestyle.
Doctor, is there anything you'd like to add about canine flu?
In general, just be aware that if your dog is infected, they can be contagious to other dogs for up to 3 weeks. The new strain of canine influenza, they're going to be coughing for a week to 10 days, and they're contagious that whole time, and sometimes for 2 to 8 days before that point. So just be on the lookout, be aware of your dog's surroundings. And if you want more information, go to dogflu.com, dogflu.com, or you can search banfield.com.
I'd like to thank you for taking the time today to talk with us. Have a great day.
Thank you. You too. Bye-bye.